Currently, the international negotiating body that was launched in 2021 has started discussing the draft World Health Organization pandemic agreement up to the end of May 2024. The pandemic agreement is a potential international agreement being discussed by the 194 member states of the World Health Organization, including Uganda. The objective is to help the world prevent, prepare for, and respond to pandemics. Spearheaded by AIDS Healthcare Foundation, Uganda Cares, civil society organizations in Uganda are not satisfied with the draft agreement on grounds that it does not fairly represent the issues of African countries, such as reducing inequalities in healthcare between developed and developing countries.
We cannot compromise on a win for Africa, and by extension, a win for global health security. At the heart of our concern is the urgent need for robust accountability mechanism within the agreement, including independent oversight. Without clear enforcement of frameworks and incentives for compliance, we risk perpetuating the inequalities that have plagued our response to COVID-19 pandemic.
And the enforcement mechanism for the agreement, the enforcement mechanism, how will this enforcement look like? I know there's already a framework and design of how the enforcement will look like. But what our concern is in terms of the financing, how are we going to finance it? How are we going to enforce the aspects of financing? It needs to come clear in this agreement. Are the development partners, are the international organization going to help the developing countries? Or as the developing countries, are we going to contribute to this preparedness ourselves?
The World Health Organization pandemic agreement has come at a time when the African Union is advancing to achieve 60% of vaccine manufacturing in Africa by 2040. Adia Nakoti, UBC.